So let's start off with the most common cause of vertigo, which is BPPV, Benign Paroxysmal Positional Vertigo. For those of you who may be new to that disorder, it's the ear rocks or crystals that you may have heard about that sit in your canals in your inner ear when they should actually be in a different place. And benign paroxysmal positional vertigo presents as a short duration of a true spinning, about 30 seconds long, based on position change. After that, the dizziness or spinning subsides, but you might feel off or nauseous with the rest of the day. The main thing is that it's short duration, it is not constant, and it is based on changing position. Now, BPPV is idiopathic, or meaning no known cause in 50 to 70% of cases. Also, be secondary, or meaning related to some event. That event commonly would be vestibular neuritis, head trauma, viral infections, or post-inner ear surgeries. It's also good to know that people who have been diagnosed with vestibular migraines or Meniere's disease also have an increased risk of developing BPPV. How do we diagnose BPPV? Well, you would do a test, a positional test. The ones that people may or may not be familiar with to trigger those crystals are the bow and lean test, the Dix-Hallpike, or the side lying test. A trained healthcare provider, a vestibular therapist, ENT or audiologist, or physician may be able to do those tests for you. So if you would like to know how to diagnose or identify BPPV yourself, I can include that in the comments below. It is also in the description of this video as a free download to help you identify if your vertigo is from BPPV. Now, what treatment options do you have? BPPV does not respond to medication. So if you do get meclizine from your provider, it doesn't cure BPPV. It might mask your symptoms a bit, but it's not going to do anything. You may benefit from an anti-nausea medication like Phenergan or Zofran to allow you to do the maneuvers that will actually treat BPPV. What treatment options do we have? First, you do have to identify which canal and which ear you have the crystals out of place. You can go to a healthcare provider to help you distinguish which ear is involved, but the treatment options are going to be canalith repositioning maneuvers. The gold standards are the Epley, the Samant Plus, or if you have it on the horizontal canal, the Gaffoni or the barbecue roll. The least effective treatment for BPPV would be Brandt-Daroff exercises, where you're just asked to lay to one side, get up, and lay to the other side. That doesn't exactly treat the crystals in an effective manner. The studies have shown that eventually it can work to dissolve those crystals, but it's pretty arduous, it takes a long time, and it really provokes a lot of symptoms of vertigo because it's not truly taking the crystals and putting them back in the vestibule where they belong. So my least prescribed would be Brandt-Daroff exercises. As always, please remember to like, share, and subscribe so I know that you want me to make more content like this and that we can grow this channel together. Until I see you next week, stay healthy, stay strong, and stay steady.